Hi everybody, welcome to the upper exercise routine. Normally we do exercise in the gym, but considering today has a clinical component, I thought I might do it in my clinical room. I'm also wearing a mask because it has to do with respiration, which I think is very important, especially given the pneumonias that is occurring with some of the people who are suffering from COVID, which is a consequence of the coronavirus that we're seeing in the community. Masks won't prevent you from getting a disease, but it might prevent you from touching your face or touching your mouth or touching your nose, which will help with the transmission of the disease. Within the practice and with the gyms, we've often done some breathing exercises, and I want to focus on that today. Remember, respiration involves muscles, and if you can train your muscles, you might be able to train your respiratory function. Not saying that this will have any ability to prevent the consequences of the coronavirus, but I think it's good to maintain bronchial hygiene or respiration. So we're going to start off with one hand on your stomach and one hand on your chest. And what I want to see you do is you want to breathe in and see if we can breathe into the muscles of the chest. So breathe in. And you should see your hand or feel your hand rise up towards the ceiling. So breathe in again. And the chest hand should move and the stomach hand will stay still. And breathe in again, that's 3. And out. We can 2 more breaths, 4. And out. And 5. And out. We're now going to keep the chest hand still, but we're going to breathe into the stomach for 5 breaths. So when you breathe in, we want to see the stomach expand and your stomach move out, so your hand should feel that your stomach presses against it. So breathe in, 1. And out. And 2. And out. And 3. And out. 2 more breaths, 4. And out. And 5. And out. Now you might feel a little bit dizzy after so much breathing. That's just because you're blowing off carbon dioxide. If you just breathe normally for a few moments, then your dizziness should recover and you should feel fine. So we'll just wait a few seconds for that to settle down. Now, when you're breathing, the most efficient way of breathing is using the stomach, right? Now, often when you see runners, when they finish a race, they bend forwards, and that's to allow their stomach or their diaphragm to help them to breathe. So we're going to practice breathing with the stomach. So we're going to breathe in for another 5 breaths, typically leaving the chest hand still, but feeling that the stomach hands move out when you breathe in and move back when you breathe out. So another 5 breaths into the stomach. So breathe in and out. Breathe in and out. Breathe in 3 and out. Breathe in 4 and out. Stomach hand stays still. Chest hand stays still, stomach hand moves. Breathe in last time and out. If you're not sure if you're doing correctly, don't worry, just keep on breathing. Now that's the mechanics of the breathing, preferably breathing with the stomach hand and keeping the chest hand still. Now we want to talk about the volume of breathing. So it's the volume or the amount of air that you're breathing in. So we want to breathe in for much longer and then breathe out for much longer. So you want to take a deep breath in, and then breathe out for much longer. So blow out. That's 1. Breathe in again. Breathe out for much longer. Breathe in for 3. Breathe in. And breathe out for much longer. Two more breaths. Breathe in into the stomach and breathe out of your stomach. Blow out all your air. Breathe in for last breath. Keep the chest hand still. Breathe in more and out. And now relax your breathing to recover. So breathe normally for a few moments. Let your carbon dioxide and oxygen settle down, and you should get over the dizziness if you're feeling dizzy. You can do this exercise in a chair, you can do this exercise lying down, you could do this exercise standing up. But the important part is to get the breath work working and trying to work on the efficiency of the stomach muscles and the diaphragm working to help you breathe. Okay, we're going to do one last round. Okay, breathe into your stomach, breathe in. Breathe out of your stomach. Big breath into your stomach. Big breath out of your stomach and keep on blowing. And in. And out. Blow, 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 blow. More. Big breath in. And out. And last breath in. Good. And out. And relax your breathing. So although I've called it breathing to stomach, we're talking about the diaphragm. Although we've tried to keep the hands on your chest still, it doesn't matter breathing to your hand. Try and practice your breathing. Now, if you have time, or if you have a balloon, is really good to practice your breathing. We often use a balloon in our classes to practice respiration, but you can play with it at home. You want to have a big balloon, have as much breath as you can coming in and going out, and have some fun. I hope you're feeling well. If you're not, let us know. We're going to add on some more exercises and make it more functional, but I hope you get something out of today's class. Thank you. Bye.